right, everyone, we are gonna go ahead and get started today. I'm Allison Ferguson. I'm the Chief Operating Officer at the Scattergood Foundation, also running the Think Bigger, Do Good policy series. And I'm going to first do some quick housekeeping, and then we'll get started with our wonderful discussion today. So we are recording. This is in webinar format. So all of the participants are muted, but you can use the Q&A and the chat to reach out to us. Please put your questions, any thoughts in the Q&A there throughout the session, and we will have specific time at the end to answer those questions. Also, if you have any great resources you want to share, put that in there as well, and we will aggregate and share those out after the session today. You will be receiving a follow-up email that will include the recording from today's session, as well as these very brief slides that we have, the paper, a feedback survey request, and any of the other great resources that come out of today's session. So quickly, I just want to give a high overview of the Think Bigger, Do Good policy series, as I know we have some folks on today that have not ever joined us. So welcome to those new faces and names I'll say on the list, and welcome to our friends that have been here before. So the Think Bigger, Do Good policy series is a policy series that has been supported by the four funders you see on the screen: PEG's Foundation, Patrick Peely, the Peter and Elizabeth Tower Foundation, the Scattergood Foundation. We've come together collectively to support this work and have a large group of individuals that help to influence this work, including our editor, Howard Goldman, and a few else. If you're ever looking at a page, you can see those names, you can see those names listed in the first couple of pages there. And so we have a variety of mental health and substance use topics that are written on. You can find all this information at thinkbiggerdogood.org. And we engage you, or ask for you all to engage with the website and us throughout the year on many of the topics related to these very important policy issues. And we also, I want to recognize psychiatric services and their support. They've been an amazing partner with us and actually work to co-publish a majority of these papers, which allows for us to both learn from each other and broaden our audiences for this work. Now we're going to get into quickly introducing today's speakers, and then I'll get out of the way and have them go for it. So Dr. Hoover, Dr. Sharon Hoover, is a licensed clinical psychologist and professor at the University of Maryland School of Medicine in the Division of Child and Adolescent Psychiatry. And Dr. Hoover is also the co-director of the National Center for School Mental Health. And kind of creating safe, supportive, resilient schools has been the focus, or a major focus, I would say, of all of her work, including research, clinical work, academia, and so forth. And that's what she's here to talk about today. And then Joe Pyle, who's the president of the Scattergood Foundation, will be helping to moderate this discussion. He's been leading the foundation since its inception in 2005, and I'm very lucky to get to work with him every day. And under his leadership at the foundation's begun to really have a focus on policy, evaluation, community participatory grant making, and figuring out how we can support organizations through robust technical assistance opportunities and elsewhere, in addition to the grant dollars that we're able to put out into the community. So that is all for me at this moment, and I'm going to hand it over to Joe. I'm going to stop sharing these slides and we can get the conversation started.
Thanks, Allie. I want to welcome everybody to the conversation today, and I hope it'll be I know it will be a rich conversation. I also want to thank folks. I see that a couple people have already put some references and resources into the chat, so thank you for engaging early here. And I'm also excited that when Sharon and I were prepping for this, that she's also received feedback that people have begun to use the paper at a state level to create influence on investing in school mental health. So really excited for the conversation and to be with you today, Sharon. So I guess I'd like to start with my first question here to get us going. Could you give like an overview of the state of youth mental health?
Sure, happy to. So thank you, Joe, and thank you, Allison, for the introduction. Thanks for the welcoming here today from the Scattergood Foundation. And I do want to give a plug to anybody listening who has not yet been engaged with the Think Bigger, Do Good series. It has been actually really instrumental for me in terms of some of the ways that I've been able to think about systems approaches to mental health across the spectrum, but in my area, particularly around child and adolescent mental health. So thanks for engaging school mental health as part of this, and I encourage folks to check that out. So now to your actual question, Joe. So where are we in terms of youth mental health? A lot of folks are certainly talking about a youth mental health crisis appropriately, and certainly on the heels of the pandemic, this has become more apparent. But I do want us to take a bit of a historical perspective, right? We know that even before the pandemic, youth mental health was a significant concern, right? So we also know that it was often underestimated and underreported, and that's despite about 1 in 5 children and adolescents in the US actually suffering from mental health concerns, mental, emotional, behavioral, developmental disorders. We know rates of suicide were climbing pre-pandemic, and many young people were struggling with anxiety and depression. And I also want to point out that certainly before the pandemic, we know that certain underserved populations and minoritized groups, particularly racially and ethnically minoritized groups and LGBTQ youth, were disproportionately affected. So a lot of these things came to light a bit more in the context of the pandemic, but we want to be really clear that this was a concern pre-pandemic and it was exacerbated by the pandemic. So we certainly did see, and more recent data has brought to light that our young people suffered greatly in many ways over the course of the pandemic. And we saw increases in suicidality and in mental health challenges for our youth. And some of those disparate experiences during COVID among our minoritized and underserved youth became even more transparent and also widened, unfortunately, including issues around access for mental health care. And, as such, I think we've all seen at this point some of our major health leaders, right? Our Surgeon General, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry really has declared this public health emergency. I think some of the data that's looked to the most often right now to understand what's happening with youth mental health is that CDC data, the Youth Risk Behavior Survey that came out that showed our girls in particular are suffering much greater rates of depression and anxiety and exposure to violence. I saw in the Q&A box, one of our participants, hopefully we can share this out with folks. Actually, it looks like maybe some of that's coming up in the webinar chat. One of our participants, Lauren, highlighted that the CDC also put out a guidance document after that data on what schools can do to help address this. And I'll just say one more thing that, these numbers, the data, the stories we're hearing from children and adolescents and families and providers are really stark, and there is reason to be concerned and to take action. At the same time, I remain optimistic and hopeful, in large part because of how we respond and engage with this issue. So young people are talking about and they're prioritizing mental health. And there is tremendous advocacy, often led by youth, but certainly across the board, there's advocacy for improvement in our youth mental health care system. So it's a time of optimism and a time of concern at the same time.
And I know later you and I'll talk a little bit about the role that peers can play, in this work. So you talked about pre-pandemic levels, the pandemic. It would appear as if we're having a moment here now. Between the federal government and states, there's an increase in funding for school-based services. Why do you think there is a moment now? And how do we take advantage of that moment?
Yeah. I mean, it I kind of alluded to it already, just this idea that in the context of any public health emergency, in a crisis, we often have opportunity, right? So people have talked about the silver lining of COVID, or the opportunity that's come with COVID to have more people talking about and paying attention to and investing in mental health for our young people. And certainly this has been part of the national conversation during COVID, but it has remained in part because of the data that's coming out, but also people are just speaking about mental health more. So I would say there's an opportunity because of the increase in awareness, and hopefully with that has come a decrease in stigma in terms of, people talking about their own experiences, their family, their friends' experiences of mental health, but also a decrease in stigma around help-seeking behaviors. So we have seen an uptick in people actually seeking help. And then alongside that, as I mentioned already, we have seen this unprecedented level of investment at the federal level, state and local levels in school mental health, certainly in youth mental health and mental health more broadly. But the area that I spend most of my time in is school mental health. And we've seen unprecedented investment there, as well as policy change. So we've seen a lot of state level policies that have really been working to advance school mental health in ways that I haven't seen in 20 plus years in the school mental health field. I may talk about it briefly later in our conversation, but I'll just mention, a lot of the work in terms of policy change and legislative action has been documented really well by the Hopeful Futures campaign. So if folks are interested in that, folks who are calling in today, interested in kind of what's happening legislatively, what are these policy movements that are happening in my state, the Hopeful Futures group, I think you can find them at hopefulfutures.us. It's a group of lots of child-serving organizations, many of whom you've heard of. I already mentioned a couple, the Mental Health America, our National Center for School Mental Health, NAMI, lots of others have come together. And this is a group led by Inseparable. They put together a legislative guide as to what's happening in every state with respect to school mental health. So it's just a great source if you're looking to see what's happening at the policy level.
Really appreciate, the resources, and I know the paper outlines many of them. I started my career in the early 80s as a special educator, and schools had school psychologists, had guidance counselors, had student nurses, had school nurses. Mm-hmm. And we seem to have lost those professionals over time. And I'm curious and very supportive of this move to school-based services and school and mental health. But why is it the right place? Like, why should we be making this investment? Well, how will we not just recycle through this, where we'll staff up, we'll fund up, and 10 years from now, we'll be going through the same cycle that I experienced earlier in my career. So, why is this the right place?
Yep. Yeah, so one thing I want to clarify is we still do have a robust workforce of school psychologists, school social workers, school counselors, school nurses who really are our frontline school mental health providers. And we talk a lot at our center about that professional group. Some folks call them, student instructional support personnel. But this group of folks who are working in schools, usually hired by schools or school districts, they are the foundation of school mental health work. And then we often augment the work that those folks are doing with community partnerships, right? So with hospital systems, community behavioral health providers, and others, peer support partners, et cetera, who are coming in to schools and doing some school-based work. So just to kind of, talk through what that looks like in practice, who the professionals are. Now, we have a robust workforce there. We absolutely are not meeting the recommended ratios. So we would advocate for, and we're seeing investments in kind of increasing that pipeline. But why should we be doing this in schools at all, right? We hear like, don't we have community mental health centers for this work? Shouldn't students and families or children and families be accessing mental health care in the community? And it's not either or, but what we do know is that schools are already and long have been a really critical place for people to get mental health care. In fact, most young people who receive mental health care receive that care in schools. And sometimes that's, hard for people to understand, but that is what the data tells us, that young people who are receiving mental health care typically receive it in schools. Certainly, some are receiving it also in outpatient care and more intensive service systems, whether it's even through child welfare, juvenile services, or in our hospital systems, for example. But schools are a place where people access care, and not only access care, but also complete some of our evidence-based practices. So we've seen data that suggests, for example, that young people are about 6 times more likely to initiate and complete evidence-based mental health care when that's offered in the school setting versus other community mental health settings. So really important for us to think about schools as part of that system of care, because young people access services there. And there's a lot of reasons why they might be more likely to access services. They're there typically about every day, at least during the academic year, and sometimes, in extended school year, and even, over the summer. But also sometimes it may be less stigmatizing. It feels like a more natural environment. And schools have this really unique opportunity to identify and intervene early, right? We can think of it as a public health approach to mental health. If we're waiting for young person's experiences, challenges, symptoms to get to the point where the family has to get them to outpatient mental health care or take them to emergency department or urgent care, oftentimes we're pretty late in that trajectory of their experience. And if we can move upstream to schools, there's a lot more we can do. In schools, I'll note one more thing of kind of why schools, right? This is, a question we get asked a lot, but schools are this place where you can also do a continuum of supports, right? We talk about comprehensive school mental health systems or a multi-tiered system of supports, but that tier 1 level of mental health promotion and prevention is really critical, right? We can't be, nor should we be, routing everybody to individual mental health treatment. There's a lot we can do universally, and even at tier 2 for students who may be experiencing more mild to moderate concerns. And schools are a really important place to do that. And it's in the best interest of schools, right? Schools typically will see this as part of their mission because mentally healthy kids learn better, right? So when kids have access to mental health supports, when they're mentally healthy, they're more likely to attend school and they will do better in school. So schools have a vested interest in this.
Really appreciate your comment about early intervention. I think too often we wait till a young person needs to be diagnosed when there's a lot of intervention that could happen pre-diagnosis. So really appreciate the idea that schools could be part of, early intervention. The continuum that you mentioned obviously is critical. And the fact that typically, because of the way payment works, you need a diagnosis. So the idea that schools could build that early intervention work is tremendous.
And if I may just piggyback on something you said there, we have seen some real innovation in terms of being able to fund, even with our public mental health system, services for students who don't have a diagnosis. I want to say it was Colorado who recently passed state legislation to allow for Medicaid funding to actually support mental health treatment without a diagnosis, which I think is a move in the right direction, right? That we are actually recognizing that we don't want to wait until students have an established mental health diagnosis to be able to receive services. So just want to put that in there, that, we want to be able to move upstream and pay for it, right? Using some of our publicly available mental health dollars and also commercial insurance.
Well, thank you for that. We all should be looking at how Colorado got that done. And to that point, can you talk a little bit about where are the funding opportunities for state and local governments as it relates to this issue?
Yeah. So I'll talk about, kind of where some of this COVID relief funding has come from, because that's what a lot of folks are leveraging right now to invest in school mental health. And then I'll also just touch on some of the opportunity around Medicaid and commercial insurance. So we think about kind of 2 big buckets of funding related to our most recent investments in school mental health on the heels of the pandemic, right? There's ESSER, the Elementary and Secondary School Emergency Relief Fund. There's a lot of acronyms, so I'll try to keep it simple. ESSER, big bucket. And then there's the BISCA, right? The Bipartisan Safer Communities Act. And both of those, each of those allocated billions of dollars toward youth education and also improving well-being among students. So a lot of states and local education authorities have used these funds to invest in their school mental health systems, right? So ESSER was really broken into 3 buckets, and I won't get into the details. Again, lots of acronyms. There's CARES, there's SURSA, there's ARPA, right? But what you need to know is really that was funding that was sent to state education agencies, really based on their proportion of funding under the Elementary and Secondary Education Act, Title I-A. And under that, states are required, because that funding is still in play. They were required to allocate at least 90% of that to their local education authorities. And then they had the option to reserve 10% of the funds for SEA, or state education agency level activities. Those funds have to be obligated by September 2024. So when we start hearing about, the federal funding cliff, especially with respect to school mental health, you hear why, right? So some of these deadlines for spending or obligating the funds are fast approaching. Then there's the BISCA, right, or the Bipartisan Safer Communities Act, which was enacted by President Biden in June 2022. That also had a lot of support for state education agencies and local LEAs, right, to expand comprehensive school mental health systems as part of their larger efforts to promote safer and more inclusive schools. And this appropriated billions of dollars, in large part through grant mechanisms through the U.S. Department of Education and the U.S. Department of Health and Human Services. So folks may be well aware of some of these grants, but I'll just name a few of them. They are still, some of these RFPs, requests for proposals, are still coming out. So if you're sitting there thinking, gosh, I don't know if our state has accessed this, or our local education authority has accessed this, check into it, right? Because some of these are in the pipeline right now, the second or third iteration of them. So for example, the Substance Abuse Mental Health Services Administration put out the Trauma-Informed Services in School grant, and then the Project Aware grant, which have been very popular in states and LEAs to expand school mental health. So that stands for Advancing Wellness and Resilience in Education. So Project Aware. And then the Department of Education has the School-Based Mental Health Services grant program, and then the Mental Health Services Professionals grant program, the MHSP program. And that one is really to expand that pipeline of mental health professionals working in schools with an intentional focus on also creating a more representative and diverse workforce. So we've seen really great things coming of that. There was also the Department of Ed's Stronger Connections grant program, which awarded about $1 billion to 56 states and territories. And that was to really focus on high need districts and schools. So all of this funding is, trickling down. Much of it has already been allocated or spent. And states have also leveraged some of the funds that came through the Bipartisan Safer Communities Act out of their mental health block grants, for example. There's also the CCBHCs, the Certified Community Behavioral Health Clinics, and Medicaid and CHIP funding and resources that have come through that. So lots of grants coming down. And I'll just also, because your question was really, I think, kind of broadly, what funding can we be looking at, or are states looking at and leveraging? So Medicaid and CHIP and commercial insurance have been really important parts of the discussion right now in terms of how we can expand school mental health. So we know that in the Bipartisan Safer Communities Act, they required a technical assistance center to be established. It was established. They also put out guidance on how to bill and deliver services in schools by leveraging Medicaid and CHIP. And they are also providing $50 million in grants for state expansion of Medicaid and CHIP funded school mental health services specifically. So a lot of work to expand school mental health. A lot of states who have not yet expanded their state plan amendments, amendments for Medicaid to expand their school services and school provider array are doing so now. So they're in the process of doing that and getting hopefully some technical assistance from that center that was established. We've also seen more attention from commercial insurers. California really has led the way here in terms of requiring now commercial insurers to fund school-based mental health services, just as their public mental health system has to as well. So lots of movement here. Couple quick kind of notes about the funding. The money has come fast and furious, right? So many state departments of ed and local education authorities have expressed that they felt like, the money is needed, but there was little time or guidance or staffing to be able to truly make the best of the funding in some circumstances. And there's concern that it's going away, right? So there is worry that the funding is not sustainable, which is obviously part of what this paper attended to, kind of what do we do to make the funding sustainable?
Well, there's a lot to digest, and I do appreciate folks that are making comments in the chat. Congratulations to the state of Vermont and to Tracy for getting a second Project Aware grant, and for Shannon's legislative body to be able to move things forward. So I would hope people would keep sharing in the chat and building out the resources that are so important to this conversation. So the paper outlined 4 strategies, and what I would hope you could do is really talk about the 4 strategies, but with a real emphasis on examples. I think, my growing anxiety in this webinar is the clock is ticking, and what is my state doing? What is my jurisdiction doing? So I think examples make it really powerful. Oh, I could call that person. So I can reach out to somebody to say, how did you get this done? Who helped you write the grant? So if you could kind of walk through this, the 4 sections, 4 strategies, I'd really appreciate it if you could give an example for each of those if possible.
Yeah, sure. I'll try to do that, Joe. And I'll make another plug because I totally agree with you. It is so valuable to have those really specific examples. So I will make another plug for that legislative guide by Hopeful Futures, because they really call out, they have whole sections on state exemplars for school mental health screening legislation, for school community partnership, for Medicaid expansion for school mental health. And that group also did a school mental health report card, which my understanding is they're about to do another one where you can look state by state. So if you're sitting in Vermont or in Maryland, in my case, or wherever you are, you can take a look at what is my state doing. And also there's a section in that report card on where are the exemplars, again, for all these kind of critical areas for school mental health implementation, essentially. So check that out. And others have done similar things that I find the Education Commission of States comes to mind, NCSL, state legislature. So there's a number of groups that have really culled what's happening in school mental health in terms of how the funding is being spent, but also the policy movement in this area. So I'm happy to share some of those resources after the session today. So as far as the 4 areas, and I won't go into too much detail in any of them, but I'll try to give a couple of examples as you asked, and folks hopefully can check out the paper to think through some of these strategies. The whole idea was, how can we sustain some of the investments that have been made? So the first was leveraging cross-sector partnerships to advance school mental health policies and funding. And this may seem self-evident, right? We need to work together. We all need to get in the same sandbox. We all know it's kind of, trite to say at this point, but we tend to work in silos. We often have separated funding streams, even when we're serving the same young people. So this is not a new issue, but we have seen success when you actually do these cross-sector partnerships with intentionality. And when they focus specifically on school mental health, you can get a lot of work done in this arena. So what does this look like? It's when you get key partner agencies together at the state level, or there can be parallel partnerships at the local level, Medicaid, public health, human services, education, healthcare, universities who are working together and coming up with shared goals, right? And then looking from a funding perspective, from a technology perspective, data perspective, how can we be working together instead of, at odds with each other? When I think about kind of who has done this well, a couple of examples come to mind. So Illinois, I know, has a cross-sector trauma collective where they have all their child-serving systems coming together. They've been working as a state in partnership, I know, with Lurie Children's Hospital and others in the Chicagoland area and beyond, to really identify what do we mean collectively by trauma-informed schools, what services need to be in place across the tiers of support. And they're working with their state legislature to really think about how can we fund this in a sustainable way versus just every district trying to grab at, different grants, different school funding mechanisms within their local community. So they really have formed this state level body that is helping shape state level legislation and funding. It's one example. There are states that have a children's cabinet. Maryland has been one of these, and we've really reinstated the children's cabinet with our new governor. So that's an example where you have at the secretary level, the child serving agencies coming together, and again, really looking at how they can braid funding together, how they can blend funding where it's feasible. Local management boards are often the parallel to that, right? Where in a local community, you have all the child serving agencies together. We have that again in Maryland, and I know a lot of states have that. Thinking of other kind of examples specific to school mental health. I know, we've been doing some work with North Carolina, for example, where they have regional entities that have been responsible for setting school mental health agendas specific to their region, but it's cross-agency doing that. So when you can have that kind of state level body and then parallel local level cross-sector bodies with a shared vision around school mental health and then some technical assistance from the state, that's ideal. And there are a number of examples of where that's happening well.
Can I just before you go to the second one, I'm trying to follow the chat a little bit, and a question was posed about specifically referencing a superintendent, but what's the carrot here? How do you make that elevator pitch to get some energy behind this? So if you're talking about these cross-sector collaborations, partnerships, what's that one message that you would recommend folks on the webinar drive home?
Yeah. Well, first thing I'll say is it might depend on your audience, right? So it depends on what state you're in. It might depend on, where your state and state leadership falls on the political spectrum. I would say that the attention to and investment in school mental health, right, is really nonpartisan, and it's an issue that everyone cares about along the political spectrum. But kind of what the carrot is and how we phrase things is often dependent on who the audience is, who's leading the advocacy. But I would say, as far as what would make a school or an education system at state or local level want to invest in this? Often they're the payer of last resort, right? So they may say, we're not in the mental health business, although most state education authorities are not saying that, but they may feel like, we don't want to be responsible solely for this. And that is the carrot for education in some ways. They know they have to attend to mental health of students to meet even their academic outcomes. Chronic absenteeism is on the rise. Their testing, the learning loss that happened over COVID is dramatic. So academic supports alone are not going to make those whole, right? Or address those in the way that we could if we had a kind of multi-sector approach where behavioral health and health comes together to support this. So for education, it meets their bottom line, right, of academic outcomes to address mental health, but they can't and shouldn't have to pay for it alone. So their carrot is, okay, if we can partner with behavioral health and get some of the funding for behavioral health to come from the community health system, right, or the public health system, then we're not going to pay for it all on our own through special education and other mechanisms. We can do this in a partnered way. For behavioral health, I'm putting it in pretty simple terms, but just to your carrot question, for behavioral health, even at the very local community level, it's an advantage to behavioral health providers to partner with schools in that even as simple as the no-show rate is much lower when you're doing this work in schools. The no-show rate in a community mental health outpatient center is 50% or higher typically. When you're in schools, that's not the case, right? You have an audience of students there. You're very rarely just sitting in your office doing nothing. The overhead cost to the community behavioral health provider are usually lower when you are operating in a school building. Telehealth has become a way to access student healthcare in schools. So lots of ways there's advantages on both sides when folks are working together.
Really appreciate that. Thank you. So I'll let you go to your number two.
I know we're going to be running short on time, so I'll move through these real quick. So second opportunity that we talk about in the paper is strengthening and expanding Medicaid coverage of comprehensive school mental health. I know I've already talked about this a bit, but just a couple things to make clear. In 2014, CMS, clarified that Medicaid can pay for health and behavioral health services delivered in schools to Medicaid enrolled students who are not on an IEP, an individualized education program, which was really important, right? Because schools typically were drawing down funds, Medicaid funds, just for students with IEPs. Now it expands their ability to do so for all Medicaid enrolled students, but states typically had to make amendments to their state Medicaid plan. And so we've seen a lot of states doing that. Some are in process right now, but there are ways that we can, and then as I mentioned already, there's a resource center and funding that's coming to help with this. But there are ways that we can and should and are expanding Medicaid to support our school mental health efforts. And some of this funding, needs to also be used for technology and training and service startup to support Medicaid reimbursement. I go into some of those details in the paper, but that's number two. An example of kind of who's doing that well, we often turn to Michigan. And I'm going to call out someone within their State Department of Education. Scott Hutchins is kind of our go-to person in terms of how have they done this? They've been doing this for a little bit longer than a number of other states, and they've really done a great job of being able to secure Medicaid funding to support school behavioral health and to expand the provider array so that they can bill for services that are offered by a wider array of providers in schools. All right, number three, data. So I talk about establishing or enhancing data systems, right? And there's kind of two levels of data systems that I talk about in the paper. One is really the kind of more surveillance data, right? So looking at what is the status of behavioral health or mental health in your student population, things like the YRBS, but other types of data systems. And then the kind of real-time data that you're getting to understand what's happening with a student who may be in interventions or treatment in your school building. Both of those data systems are I think, generally relatively poorly constructed in many of our school systems. They're not well funded. We often see a lot of homegrown kind of data systems where, paper pencil, really well-intended use of Excel. It surprises me that we have not established a more robust way at a national or even state level for establishing data infrastructure that locals could use, that they could take so that they're not sharing their data with the state or the national developer of a data infrastructure, but the data infrastructure is there. And we have a precedent for doing that. I mean, school climate data, the U.S. Department of Education established a system for, a platform rather, for assessing school climate data. And then local communities were able to use that platform, but the data remained with the local community because, of course, there are appropriate sensitivities around privacy. I speak in the paper around kind of cross-sector data sharing, which is a really important thing that we need to accomplish in school mental health, right? At the very least, education and behavioral health. Some examples of who's doing this. Seattle is a local community that I would say is ahead of a lot of other communities in terms of that behavioral health education data sharing. They have great examples of kind of data sharing agreements between those two agencies. At a state level, Connecticut, they have a purveyor, the Child Health Development Institute, that has an evidence-based program, EBP tracker, I think it's called, and it's a data system that is statewide, and all behavioral health providers for children, including your school behavioral health providers, are required to enter data in that when they're serving students. And it's been beautiful in terms of what they've been able to put out to document impact. So I'll leave it at those few, and then just the final.
Well, before you go to the final one, just to,
Okay.
because I think we'll be okay on time.
Okay.
So I really do appreciate the examples, because I think that too often in this conversation, people talk about we can't share data. There's restrictions. The confidentiality prevents the flow of data. And I think, whether you're talking about Connecticut or Seattle, the fact is you can share this data. And I think, your comment about, I think you used the word beautiful, that, to see the beauty of the impact when we share data. So I just really appreciate that. And I think it's a good frame for all of us that there are, examples. I think Allegheny County here in Pennsylvania has been really good on data sharing as well. So, it's really about, bringing together a group of the willing to create that opportunity for kids. So really appreciate that.
To be at the table in that discussion. I mean, I just want to emphasize that, families, parents often feel left out of the conversation. And then you get into, these battles of, families feeling like they are unaware of what's happening with their child's data, right? I'm a parent of three teens myself, and I do want to know what information is being collected of them and how it's being used. So families have to be at that table as these data systems and agreements are being established.
Terrific. So I'll let you do the fourth one.
Yeah. All right. So the fourth one was, creating technical assistance and professional development support at the state level for local education agencies to support their school mental health implementation. So this can look like a lot of things. I go into some of them in the paper, things like creating a compendium of evidence-based practices that, the state is providing technical assistance in. So Massachusetts, for example, the Judge Baker Center put out a document that really laid out, here's all the evidence-based practices that local education communities can avail themselves in our state. Connecticut did something similar just a few years before, looking at kind of the evidence-based practices they could get training in. So that's one example of how kind of a state can do a resource mapping essentially, and also identify what evidence-based practices or implementation supports can the state support local education communities with. Some states have established TA centers, which I think is a really nice model for both kind of respecting the idea that local or education is local, right? And things need to be tailored to the local community. I mean, I think again about Maryland, where I reside, our western part of the state is vastly different from central Maryland, is vastly different from the eastern. So assuming that we could do everything the same for everybody would just be really erroneous. But what we can do is recognize that there's some universal support that can be housed at the state. And so we've seen Connecticut, Iowa, Massachusetts, South Carolina, just in the last few years, establishing these state TA centers. I also want to give a call out, SAMHSA for the last 6 years has funded the mental health technology transfer centers. There are 10 regional centers, and they have put out fantastic school mental health resources that have really helped at a regional level. So these could be done state level, these could be done regionally, but some of the investments that are happening right now really can be used at least to create these state TA centers and some of the infrastructure that goes along with that.
Well, that's great. So you just mentioned this idea that, families need to have a seat at the table. And you and I, when we were prepping for this, really talked about the emerging role of peers, of students in this work. So can you talk a little bit about that?
Yeah. I mean, as I, again, kind of mentioned at the beginning here, that's part of what gives me hope is that we've seen youth driving a lot of the advocacy work around youth mental health in recent years. And we've, partly under kind of the system of care principles, really recognized and in many, many places valued the idea of youth leading the work here. That's not the case everywhere, right? And a lot of tokenism still happens and people still being unsure of how and even why to include youth, but we've made progress, and some organizations like, Youth Move and Active Minds have really helped us drive this work in terms of youth being at the forefront. And you mentioned peers, and this is an area that I think there's so much untapped opportunity in terms of equipping young people, not only with mental health literacy, which we are seeing legislated right at the state level and local level, that mental health literacy needs to be embedded in the K through 12 at least curricula, but also, so they can understand how to obtain and sustain positive mental health and seek help for themselves or peers, but also equipping peers with the tools to help others, right? So we have seen, and whether it's through Youth Mental Health First Aid, there's the Be There certificate that I know, Lady Gaga and her group put out, and it's a way that young people can equip themselves with these tools, because when you look at the data, oftentimes the first person that a young person who's struggling goes to is a peer. So we need equipped adults, that includes educators, but we also need equipped peers. And there are states that are leading the way in terms of actual reimbursement for peer mental health specialists. We have to think way more broadly about what we mean by a mental health workforce. Not everybody needs to go see a child and adolescent mental health specialist with a doctorate degree, right? That may not even be the best fit for a lot of young people. And if we're not suggesting that our young people all need to become child psychiatrists or, child psychologists or social workers, but they can really be a part of this continuum of care.
You mentioned you're seeing it in action. Is there one particular location, jurisdiction you're seeing it in?
Yeah, so we have a national conference that we do each year, the Advancing School Mental Health Conference. This year it's going to be in Orlando, actually in early December. We just announced it this week, so I'm excited about it. And at last year's conference, which was held in New Orleans, there was a group from California that came and spoke about their school-based health centers and how they had established and implemented this peer support model. They did a workshop, I want to say, where they went over kind of how they established it, how it's funded. And again, California has been leading the way in terms of really thinking about how to more broadly fund a provider array that goes beyond just mental health specialists, right? Including peer support specialists. So that example comes to mind. I'm happy to share that resource after today's session.
Sounds great. Well, as we approach the end of the webinar, and I have like one last question, and then hopefully, I think Allie's been trying to curate some of the questions that are coming up in the chat, that we'll have a chance to get to a couple of those before the hour disappears. Obviously, you know this work tremendously, and this has been a great asset to, I know, myself and probably many of the people on the call. What's the one action that you would want, as a leader in this space, as an advocate for this work? You've got 100 people on this call, let's turn them loose. What do you want them to go do?
Yeah, and I'm sure that of the people on this call, there are already people doing great work in the school mental health space. So, and we can do great work, right, from various seats at the table. And so the thing I would think of in terms of a general action that could apply to a lot of people is find a seat at a table that you're not at already, right? And that can feel overwhelming and daunting, especially if you have not been at, say, the seat of your local education agency to kind of understand what they're prioritizing and how they're investing in school mental health. It can feel a little daunting if you've never partnered with your state departments, but they will often welcome participation from, whatever your lens may be, a young person, a family member. If you are a young person or family member, I would encourage you to even partner with your local advocacy groups. I've mentioned a few: Youth Move, Active Minds, they have chapters everywhere, but also certainly NAMI, the Federation of Families. and ask how they are thinking about schools as an important part of the continuum of care. There are a lot of advocacy tools that you can use, and state school boards and local school boards are an important place to go and speak about why this matters to you. We have briefs that we put out to help people do just that from whatever your position is. So get a seat at the table. I would encourage folks to use some of the resources that I mentioned from Inseparable to understand a little bit more about what's happening in their own state, and then to bring examples from other states. Oftentimes, our legislators may be champions of this work, but may not be sure how to concretize it into policy. So use those resources to bring examples, legislative language, examples of where this is going well.
It's great. I do appreciate the fact that we all need to find a seat at the table and then use the knowledge base that you've been so helpful in creating over the years to raise up that voice. Before we turn it to questions, is there anything in the paper, there's tons of things we could talk about. Is there anything in the paper or any point that you'd like to make before we turn it back to Allie?
So I think one point that we didn't necessarily touch on as much today, and I touched on a little bit in the paper, I've talked in more in depth in other places, is that when we talk about a full continuum of mental health supports in schools, we really have to think about that middle tier of supports and how we fund and staff support there. So oftentimes schools will have universal supports like mental health literacy, social emotional learning, positive behaviors, school climate. And then when a young person's struggling, they default to, individual therapy and billable, reimbursable service or care for that student, because that's how we get paid often, and that's what we're staffed for. I think we have to be much more intentional as a payer system and as just education and behavioral health and health systems about what does this tier 2 look like? How can we identify early, provide, brief supports, and there's great examples of brief supports that are out there, and get kids back on track so that we're not always defaulting to an already overburdened tier 3.
And I would just say that I think that's a really powerful statement, because I think what we know is that when we default to the current system, with all due respect to it, it's failing us. Yeah. It's failing kids. So if we're not looking at these other tier 1, tier 2 systems, we're not going to be successful in this. So I think that's a really powerful way to kind of wrap this up. Allie, I think we've got like 4 or 5 minutes left. And I do want to thank you, Sharon, for all the information you gave us. And I know I'll be listening to the recording again to get it all down. So I want to thank you for that. So Allie?
Yeah, so quickly, I'll just say, for those that are asking for specific links and data points, we will send those afterwards just to kind of use the next 6 minutes efficiently. So Heather, Mar, we will definitely share that, as well as anything else that's been shared in the chat or mentioned. We'll try to do our best to aggregate it all. Sharon, one thing in the chat that was kind of coming through in a theme that I think we won't get too political here, but so we have the cliff in September. We also have many states and federal elections in November. What should we be thinking about as administrations change? So do you have any recommendations on either level? If there ends up being administration changes for us, what should we be preparing for?
Yeah. So I would say 2 things. One, thankfully, school mental health and youth mental health has been supported across the political spectrum. I know I already mentioned that, but this is an issue that everybody is impacted by and that everybody cares about, and investments and policies reflect that, right? So it's not that we're only seeing advancements in blue states or red states or purple states, right? It's across the aisle and across all of our states that we're seeing fantastic work done. Check out the report cards, the legislative guide, you'll see it across. So lots of people care about this, and identify those champions within your state across the political aisle, right? We don't want to just target one side of one aisle here, right? One side of the aisle. The second thing is we know that there are realities that some of our young people who are more vulnerable, our LGBTQ youth, our minoritized youth may be more vulnerable within their local, state, or national communities under different political administrations. And so I think as people who care about mental health, we have to really raise up our efforts to protect our young people who are potentially more vulnerable and in harm's way, and have to really be advocating for supports for them, no matter who is, part of our federal or state administration.
Great, thank you. Then I'm going to move on to Heather's Fullerton's question. So wondering, where do you think we should prioritize funds for greatest impacts for students, nonprofit service providers, schools themselves, addressing provider shortage and building out adult SEL capacity? And so she is a county government funder that funds youth mental health services.
Okay.
So if we have to put you on the spot, pick one thing that you would prioritize, because we know we just listened to an hour of wonderful things you could do.
Oh, and I'm probably going to give you an answer that's not as specific as this questioner may like, but I would say it depends. It depends on what's already being funded in your local community, where there's momentum, what your students and families and educators prioritize. You want to sometimes go with the low-hanging fruit, right? If you've got momentum behind putting mental health literacy into your curriculum, put energies there, right? If you've got momentum and a need for creating a more diverse and representative school mental health workforce, put funding there. In general, I would say move upstream with your funding. I mean, that's a pretty general response, but we often think downstream, the most intensive tertiary levels of care. We have a public mental health system that is supposed to, be responsible for that. So if you're a foundation or a funder, a philanthropist in this space, I would say think upstream in terms of your investments to complement that full continuum.
Well, I think we're about ready to wrap up, and I just really want to thank you. Thank Allie for putting this together. I do want to thank everybody who's joined, and I do want to say you've been really good at keeping people on, which is always good. I always look at the number like, okay, is it, where are we headed? And you've managed to keep everybody engaged here for the hour. And I know there's lots of interest in people kind of sharing information. So I would hope that, we could all do that, because I think our kids and our schools, need these kinds of supports for communities to thrive. So just really want to thank you, Sharon, for all the work you and the center are doing, and thank everybody who joined the call today. And Allie, is there any last minute cleanup before we say goodbye?
No, just that you will get a slew of resources after this. It usually takes us like 24, 48 hours to get the video uploaded and captioned and ready for prime time on YouTube, but we will send that out to everyone that both joined and registered for today. And that is it. And we will do our best to share all of these resources that were discussed. And feel free, if we miss anything, let me know and I can send it back out to the group.